back to Urban Wellness Now. I am Cynthia Brooks Nickerson. Okay, so sexually transmitted infections are becoming more common in older adults. Rates of chlamydia, gonorrhea, and syphilis in people ages 55 and up more than doubled in our country over the 10-year period from 2012 to 2022. This is all according to the CDC. So, what's going on with folks 55 and up and their sexual health? Joining me now for this conversation is Dr. Cristal Lynch. She's a gynecologist in Torrance, here in Southern California. Dr. Lynch delivered babies for 30 years and recently decided to concentrate more on the gynecological side than the obstetric side. All right, so Dr. Lynch, we know that these sexually transmitted infections are something that people need to be concerned about as they age older and having sex. What are some of the other things that women need to know specifically?
What we need to be aware of is the effects of the waning hormones. The testosterone starts to decrease and the estrogen starts to. The testosterone is largely what's responsible for our libido and also for a lot of flexibility and moisture of the vagina. And the estrogen gives a really nice condensation when there's a sexual arousal, that lubrication for sex to make it easy. So we have dryness, thinning of the vagina that leads to thinning in the vaginal mucosa that leads to possible tearing of the tissues with intercourse, bleeding with intercourse, and then a susceptibility for infection. Um, I think when people start to go through that transition, it's good to talk about it with the gynecologist. Let somebody look at the vagina and see what the status is. You may be okay at that point to just have a moisturizer, just a simple suppository of hyaluronic acid, coconut oil, olive oil, almond oil, these things from your kitchen. All of these can be really helpful for maintaining moisture. When it gets to the point where you need to have some sort of hormonal addition to that, that can be affected with either a pill or a suppository, gels, creams, all sorts of different ways to administer that intravaginally that would not put you at risk for any sort of carcinoma. So, a lot of people have periods of where they're not having sex at all, like celibacy. There's divorce, there's widowhood, there's all of these things that happen around the time that our hormones are really dropping down. And it's important if we're not having penetration, we need to get blood flowing to the area. So that's where all of the stimulatory devices can come in handy as
Like
well.
toys?
Yes, like the toys. So we have, the more popular toys are used to be those wands that basically give super powerful vibratory stimulus. Now the most popular ones are the ones that do bring moisture in. There's the one called the Rose. There's the Lilo Sona. All of these are basically almost like suction sort of devices where they bring the blood supply into the labia and around the clitoral area. And so this is just really key because maybe we don't have a partner, maybe we want one, but we can still keep our tissues up to par.
And have
Okay.
fun
Yeah.
doing it, huh?
So that is a heavy recommendation of mine. Okay. So, and many other,
Hey,
I have
the
so much
doctor said
of
it.
many
Go to
things
the
I can show you
doctor.
on another day, but
Okay.
this is your
All right.
prescription. This is a prescription. Okay.
Go buy a rose.
So that's for like the shrinkage. Yes,
Hmm.
get a rose or a little Sona. So these things are really important for avoiding constriction of the opening of the vagina, where it can just be painful intercourse is one of the other problems. So the problem is dryness. The problem is pain. This is what keeps people from even wanting to have intercourse, and it will affect the libido. The other main problem is reduced libido, and the other is reduced arousal. So let's say you're in, but you just are not getting lubricated, you're not getting aroused, you feel like your orgasms that used to be stars and stripes forever, Love American style, pow pow pow, now it's just like sort of womp womp, that sort of thing. To increase arousal, we have many arousal gels that can be placed around clitoris and labia minora, and then there's Viagra, which is off label for women, but can be administered to women. There's Viagra cream or gel that can be administered to the
Oh,
clitoral
okay.
area and the
So
labia
so
prior to
so Viagra
intercourse.
not just for men, Dr. Lynch. That's a new, I didn't know that.
Viagra is, yes, well, this is off label, but it is okay to do. You can
Oh,
take it the same way orally, 30 minutes before intercourse, the same way that men would do. Of course, you get your clearance beforehand about all your cardiac fitness and everything. But there's also compounding pharmacies that can compound all sorts of arousal gels and creams, and it's placed around the labia and clitoral area. They have, and every ingredient that's in these is meant to dilate blood vessels to bring blood in. The key to the whole thing is get the blood in, the moisture comes after. The arousal is accentuated with that. So Zestra online you can buy. You can go to compounding pharmacy and get it compounded. You can use a Viagra Denafil, which is Viagra cream, or you can take an oral Viagra too. Arousal also, I got a really great thing for this. There's a pen called Vyleesi. It's like an EpiPen, and you give yourself injection in the thigh 30 minutes or so before sex. This stimulates this melanocortin receptor site in your brain, and this helps you with enjoyment and arousal for the event. So this is some groundbreaking, awesome thing for women right now.
so is
So
it
that's
so
the
you
arousal
go to the
piece.
doc, it's a prescription product?
That's a prescription. That's right. That's a prescription product. Just comes in a pen. It looks just like the EpiPen or like the pens that the Ozempic and everything are coming. Same sort of thing.
Oh
You
yeah, yeah.
just shoot yourself in the thigh. So there is
Wow.
that. Okay.
Okay, so you're telling your
I
partner, "Hey,
know.
just 30 minutes. Hold on. Let me give myself my shot and then we'll be good."
Well, I don't know, but say you might just go and give it to yourself, or you might know it's date night, or you
Oh,
might
okay.
be starting to feel something. So so you give it to yourself, and then you go have dinner. Let's say you give it to yourself and you have a fight, and you're thinking, oh wow, this isn't going to happen. Well, it's still good for 2 hours. So yeah,
Oh, okay.
main side effect from that is just a little bit of nausea. So you can do
Well,
that. Then, so besides the arousal part of it, people also can find that they can enhance desire and arousal just by mindfulness of, focusing on what we're doing. The women have just so much going on with, we're sandwich generation in the menopause. Maybe we have elderly parents and we have lots of worries, and we have some sociocultural things too, where maybe people have just forgotten about you, put you out to pasture because we're menopausal now, and think we're not sexual beings. And then there's depression, and people are on
mhm.
Zoloft and Paxil and all those meds, and they also inhibit sexual desire. And arousal. So there are a lot of factors, I think, in menopause, not just hormonal, that really come into play into the whole sexual response. So we talk about mindfulness in terms of being able to be more orgasmic and aroused. And so you are glomming and focused on everything that you see, you hear, you smell, you taste, you feel. Five senses, engaging every single one. And something I feel super interested in is the fact that that olfactory bulb, when you smell something, the olfactory sensor receptors are, are located in the brain right next to two centers, the amygdala and the hippocampus, where memories are created and where emotions are stored. Okay? So this is really interesting that like when you go somewhere and you smell something and it will evoke a memory and it'll be pleasurable and emotionally satisfying. It's the same in the whole sexual arena. So there's lots of volumes of things written about mindfulness with arousal. So that's the arousal piece.
All
And,
right.
and
Well,
then the third thing is desire. You know, you got to want to do it.
yeah. Yeah.
So for that, we have a pill that you can take every day that is called Addie. This is also something new. It was an antidepressant for women, but it has the side effect of causing an increase in desire. So it was no good for depression, but it caused a lot of the women to have a lot of increase in desire as a side effect. So it became to be marketed as something for desire. So it doesn't work in every woman's brain. For some, it doesn't work. And if you have two drinks, alcoholic drinks, the day that you take it, you could have low blood pressure. So you have to be careful not to have, if you're going to have two drinks and you know it, you don't take it that day. Okay. But it can work. And after 6 weeks, if you've taken it daily and you still don't want anything, you still have no desire, then it's not for you. It's not compatible with your brain. And then you just stop. We also give testosterone for desire. We give it either in a gel form or we pellet, or we can give it in cream or patch. And testosterone um, improves body image for a lot of women because, in menopause, your body composition changes. There's weight gain and
Yes.
there's more like mid portion, mid segment weight gain,
Hmm.
and helps you work out more, gives you that mucin production in the vagina, and helps a lot of people with more arousal, more orgasm, and it helps them have feel better about themselves. So
All right, Dr. Lynch.
there are lots of different things for libido too. I know I'm going on.
Yeah.
Well, I'm just telling
No,
you all the
that's
things that we have. Yeah.
Dr. Lynch, I certainly appreciate this. I know many women who are watching this definitely appreciate this because there has been just not enough research and information out there for
Hmm.
women, older women who, are still sexual beings. So I guess the key
Yes,
is wherever you are
exactly.
watching or listening to this, don't be afraid to talk about it with your gynecologist, right?
Yes, exactly. Do come in and definitely bring it up. There is a lot more than there ever used to be.
That's perfect news. Thank you so much, Dr. Lynch. Definitely appreciate you, and we're going to have you back on to
Oh,
talk
you're
about
welcome.
some other topics. That's perfect news. Thank you so much, Dr. Lynch. Definitely appreciate you, and we're going to have you back on to
Oh,
talk
you're
about some
welcome.
other. Do you practice mindfulness? Do you even know what it is? No worries if you don't. I wasn't real sure until recently. Well, the good doctor, Cristal Lynch, mentioned mindfulness in her segment, specifically when it comes to intimacy. So we want to make sure you have the right information. Get your free beginner's guide to mindfulness at urbanwellnessnow.com. Learn how to be fully present and aware of everything around you so you don't get overly reactive or overwhelmed. Train your brain to be mindful. Your free guide is available for a limited time, so go to urbanwellnessnow.com, download and print it out, and get mindful. Thanks so much for joining Urban Wellness Now. Please visit us on social media, including YouTube, and go to urbanwellnessnow.com for more information on the topics discussed on this show and additional resources for your health and wealth. And send me comments about the show. I'm Cynthia Brooks Nickerson. See you next time.